Medicare Part B is one of the pillars of original Medicare. Almost everyone over 65 has it because it's the part that effectively covers your doctor visits. But if you don't understand it, or you don't sign up for Medicare Part B at the right time, you can end up with permanent penalties that will follow you for the rest of your life. I know that's harsh, and that's exactly why it's so important to understand this. And not only are there permanent penalties, but also there are a number of other ways that you can lose money if you don't know what you're doing with Medicare Part B. So in this video, I'll go over everything you need to know about Medicare Part B, including what it covers, all the costs associated with it, and how and when to enroll. And make sure you stick around for the last part because that's where I'll tell you how you can avoid the permanent Medicare Part B penalties. I'm Calvin from PlanFit, and I've been helping people understand Medicare for 14 years now. And this is everything you need to know about Medicare Part B. To get started, first let's talk about what exactly Original Medicare is. When we say Original Medicare, we're talking about the federal government's health insurance program that's provided directly from the government. It doesn't pass through an insurance company like some of the other parts of Medicare do, and Original Medicare consists of two parts, Part A and Part B. Medicare Part A covers you for inpatient hospital stays, so it's about your hospital costs. So if you're admitted to the hospital, Medicare Part A will help cover that. If you go into a skilled nursing facility, that's also part of Medicare Part A. In the previous video in this series, I talked about Medicare Part A, so go and check that out if you haven't already. Now, Medicare Part B is all about outpatient costs, where Medicare Part A was inpatient. And let me tell you, there are a lot of things that Medicare Part B covers. Medicare Part B covers most of the medically necessary items and services, which are services that doctors recommend getting to either diagnose or treat a health condition. If you go to a doctor's office, that's usually going to be covered by Medicare Part B. If you get preventive services like diagnostic tests or disease screenings, or even vaccines or flu shots, those are all things that are covered by Medicare Part B. Medicare Part B also covers lab work, clinical research, ambulance services, durable medical equipment like wheelchairs and glucose monitors, and many other things. It really covers a lot of your health care. Now keep in mind that the things I've listed are just categories of what Medicare Part B covers. If you want to find out if an item or service is covered by Medicare Part B, you can head over to medicare.gov/coverage to find out exactly what Medicare will cover. Now before I talk to you about the costs of Medicare Part B, let me just go over some things that Medicare Part B will not cover. So firstly, Medicare Part B is not the branch of Medicare that covers your prescription drugs. Yes, Medicare Part B does cover a select few drugs, like drugs that are delivered through infusion, such as chemotherapy, but most of the time you'll need drug coverage through a Part D prescription drug plan, such as one that you get in a Medicare Advantage plan or one that you can get as a standalone prescription drug plan. Medicare Part B will also not cover most vision, dental, or hearing services. So things like eyeglasses, teeth cleaning, and hearing aids, all of those are not covered by Medicare Part B. And finally, Medicare Part B won't cover you if you get items and services from providers that don't accept Medicare. So it also matters which doctors that you go to and if they accept Medicare to have the full coverage of Medicare Part A and B. So keep that in mind. Now, before we go on to the costs of Medicare Part B, let me just jump in here and say that if you're finding this video helpful, please leave a like. This helps our video to reach other people who may need help understanding how Part B works. Also, if you want to watch our full series on the parts of Medicare, hit subscribe. I already have a video on Medicare Part A, but I'm also publishing videos on Part C, Part D, Medicare supplement plans, and more things. All right, let's get back to the video. The next thing we want to look at are the costs of Medicare Part B. Now, there are 4 costs to Medicare Part B that you really need to be aware of. These are premiums, deductibles, co-insurance, and Medicare Part B excess charges. If you've seen my Medicare Part A video, you'll know that most people don't have to pay a premium for Medicare Part A because that part of Medicare is mostly funded by taxes. When you were working, you were paying Medicare taxes, and those Medicare taxes fund Medicare Part A. With Medicare Part B, however, it's a different story. When you enroll in Medicare Part B, most people have to pay a monthly premium to have it. And the base costs for that are $174.70 in 2024. Now, I say base cost because Medicare has income brackets known as Medicare IRMA. IRMA It stands for Income-Related Monthly Adjustment Amount. Or in other words, Medicare will adjust your monthly premium based on the amount of money that you make. Now here's an IRMA chart for 2024. Now keep in mind that these numbers are taken from the modified adjusted gross income that you had 2 years ago. So if your MAGI was greater than $103,000 in your 2022 tax return, the Medicare Part B premium will cost more for you in 2024. Now, if you're earning significantly less now than you were 2 years ago, you may be able to contest your IRMA bracket. And you do that through Social Security. Go over to Social Security's website and search IRMAA to find out how to do that. Now, in addition to the possible increased costs of IRMA, there can also be Medicare Part B late enrollment penalties. I'm going to go more in depth into the late enrollment penalties when I talk about enrollment for Medicare Part B. But basically what this is a permanent fee attached to your Medicare Part B premium if you sign up late. Okay, now aside from the premium, Medicare Part B also has a deductible. The Medicare Part B deductible is the amount that you have to pay out of pocket before your Medicare Part B coverage kicks in. In 2024, the Medicare Part B deductible is set at $240. Now, once you've met that deductible, most of the items and services covered by Medicare Part B will come at a 20% coinsurance. That means you will pay 20% and Medicare will pay 80%. There are some exceptions to this. For example, most preventive services are 100% covered by Medicare Part B, but as a rule of thumb, once you've paid your deductible, Medicare will pay 80% of the cost and you'll be responsible for the remaining 20%. And remember, there is no limit to that 20%. You will keep paying it all year and never hit this maximum out of pocket. So if you have a lot of treatment, you could end up spending $10,000 out of pocket on $100,000 of medical bills, or even more. That's why even though Medicare Part B is great, we highly recommend getting additional coverage. And in the next few videos in this series, I'll be talking about your additional coverage options, which boil down to essentially two options: Medicare Advantage plans or Medicare Supplement plans. But all right, the last cost you need to be aware of for Medicare Part B are the Medicare Part B excess charges. So most healthcare providers that accept Medicare also accept the Medicare approved amount for items and services. Medicare calls this assignment. Medicare has made a schedule of fees and assigned a price for all items and services related to your health care. If a provider does not accept assignment, they still may accept Medicare but not assignment. And in that case, they can charge an extra 15% over the Medicare approved amount. So instead of paying just your 20%, you could be responsible to pay 35%. The good news is that there are only a few healthcare providers that do this, but sometimes they're the big names of premier clinics or premier hospitals that charge excess charges. But of course, you can always ask beforehand if your doctor or healthcare provider takes Medicare and whether or not they take the approved amount or they're going to charge you an excess charge. All right, so those are the costs for Medicare Part B. Now let's talk about enrolling. Generally speaking, you qualify for Medicare Part B if you're 65 years of age or older. You may also be able to enroll if you have disability and you've been on disability payments for 2 years, or if you have end-stage renal disease. But the majority of people who enroll in Medicare Part B are 65 years old. Now, there's a very important enrollment period that you need to know about. It's called the initial enrollment period. It's a 7-month window that typically starts 3 months before your 65th birth month. And it includes your birth month and then 3 months after your 65th birth month. Most people should enroll in Medicare Part B during this time to avoid the late enrollment penalty. There are exceptions to this, of course, which I'll get into in a bit, but most of the time you should enroll during your initial enrollment period. Now, if you miss your initial enrollment period, you can enroll during the general enrollment period, which runs from January 1st to March 1st every year. However, keep in mind that if you don't qualify for a special enrollment period, then you're going to get permanent penalties on your Medicare Part B when you sign up. The penalty is that you will have an additional 10% on your premium for every year that you were late enrolling. So the longer you wait to enroll, the more expensive that your premium becomes. Now, you might be wondering about the exceptions and how you can get a special enrollment period. Well, there are a lot of special cases, but one of the most common ones is that you're still covered by your employer health plan and Medicare considers it to be creditable coverage. In this case, if your employer has 20 or more employees, you can choose to delay enrolling in Medicare Part B and stay with your employer's plan instead. When you leave the company or when your coverage ends, you'll have an 8-month special enrollment period where you can enroll in Medicare Part B without worrying about the late enrollment penalty. Again, this isn't the only time that you can get a special enrollment period for Medicare. For the full list, you can check out Medicare's official website, and I'll leave a link in the description below so you can check it out. Now, if you want to enroll in Medicare Part B, you go over to ssa.gov and you enroll there. Or you can visit your local Social Security office and enroll in person, and you can also enroll over the phone. Enrolling in Medicare is handled by Social Security, not Medicare. So you have to enroll through Social Security. And that's about what you need to know about enrolling in Medicare Part B. If you have questions, leave a comment below, or you can contact us for professional help at no cost to you. You can call or text us at 877-360-6565. Other than that, thank you for watching, and in the next video, I'll discuss Medicare Part C, which is also known as Medicare Advantage. I'll see you there. Bye-bye.